Good evening to all the viewers who are watching live and will be watching in the recorded version. In brief, let me just tell you that today's quiz program was being cancelled due to some server issues, which we are yet to be fixing. We are going to fix sooner or later. And so it is. We are having some delays due to ongoing exams on our sector. So that's why we are facing some delays with the IT issues. So please bear with us. And also, we have some interesting updates to be noted. So stay with us till the end of this video plus live till the end because we will be sharing and details about it and you will be getting an idea of what it will be the main idea. So without wasting any more time, let's just start our today's game.
Good evening, everybody. And day by day, we are counting our CME numbers. So tonight, we are on our 56th episode of Continued Medical Education Program of National Institute of Homeopathy Alumni Association. And we have very important information to share. We are proud to good evening, Kalyani sir, our
Good
president.
evening.
Thank you, sir. And we have very important information to share. That is, the satellite unit of National Institute of Homeopathy has been launched, and a program has been held few days back at Delhi, Narela. So we are expecting to get the inauguration of this satellite unit of National Institute of Homeopathy at Delhi, which will act as an international platform to coordinate with the other states for the development and of homeopathy with our country and abroad. And for that, we are thankful to all the authorities of NH, our directors, the Ministry of Ayush, Government of India, for propagating and promoting homeopathy to a larger extent. For NIH Alumni Association, we have another very good news to share with our IT team, headed by Orko, had been putting the CME highlights on Spotify. And now the young generation is very well aware of the Spotify application. So the CME highlights every Friday or Sunday, the IT team will be putting one CME highlights in the Spotify. So you can learn and enjoy the CME highlights if you are not getting YouTube through Spotify too. Now we have a very what to say uh, crucial announcement to say that tonight our speaker, one of our speaker, Dr. Ehtesham Khan, will be unable to present his part as he is by the side of his ailing mother, who is seriously ill and might be undergoing some operation for gallstone. So let's all pray for Dr. Ehtesham Khan's mother for her speedy recovery. And to replace Dr. Ehtesham Khan tonight, we are lucky enough to announce that we'll be having another eminent speaker and who will be enriching us with his vast knowledge. But I'll not disclose the name. I'll request with permission of Kalyani sir uh, to bring upon our inaugurator tonight, Dr. Saptarshi Halder.
Sure. Please call him.
Thank you, sir. Now we have with us our inaugurator. We are proud to have Dr. Saptarshi Halder, Assistant Professor of Calcutta Homeopathic Medical College and Hospital. And over to you. The stage is all yours, Saptarshi.
Okay, thank you, Thank you, Biduda, and thank you. Good evening, everybody. Thank you, Biduda, and thank you, Dr. Kolani, sir, and for this session. And actually, one small mistake was there that I am not assistant professor of Calcutta Homeopathy. I am still a lecturer there, and it's my honor to inaugurate the CME at this virtual platform tonight. And this is my first appearance at this alumni group, and I'm happy to interact with the NHNs after a long time. And as a brief introduction about myself, I am Dr. Saptarshi Halder, and I've done both my UG and PG from NIH Kolkata, and I was a medical officer previously. Now I am working as a lecturer at the Calcutta Homeopathic Medical College and Hospital in the Department of Community Medicine. And now let me introduce with our speakers tonight. And we have among us our eminent speaker, Dr. Narayan Kolkata, who needs no introduction, and he was a senior research officer at NIH. We are honored to get his valuable guidance during our NIH days. He is a very good clinician too, as we all know. And just one brief note that Viduta just said that one of our speaker, Dr. Ehtesham Khan, is unable to attend today due to ill health of his mother, and I wish his mother speedy recovery. And Mr. Khan's part will be addressed by Dr. Devnaran Kolani, sir, and he will speak about the private practice after BHMS, the present scenario, challenges, and the way forward. I am sure he will enrich us with his vast knowledge as well as some of his unparalleled clinical tips. And we have another esteemed speaker amongst us, Dr. Srimonti Sanyal, and she is UG from NIH and PG from Mukherjee Medical College. She is a research fellow at this CCRH, Delhi. Presently, she was in Anjali for a short time. Her topic today is geriatric health in India. I think this is a very neglected area in clinical practice, and she will do justice on her topic. As a moderator, we have Dr. Raja Manoharan, Associate Professor, National Institute of Homeopathy, Department of Homeopathic Pharmacy. He is an esteemed teacher and associated with various research projects. He was also awarded gold medal by Vinayaka Missions University in 2008. Uh, and I wish that the CME will be very informative. And last but not the least, I want to I just want to pay my sincere gratitude to Dr. Bidyut Mukherjee, and without whom this type of CME cannot be cannot be completed. And he he the we know that the our alumni meet is going to be held on 9th December at NIH. So let's all join to that alumni meet and make it a huge success. That's my only request to come forward and join that alumni meet. And I wish the CME will be very informative tonight. And now uh, I want to call upon Dr. M. Raja, the moderator, to continue the next program of this to the next part of this semi. Dr. M. Raja.
Hello.
Yes.
Hello. Sir, I'm audible.
Uh, yes, sir. Dr. Raja, you are audible.
Yes, I can hear also. Dr. M. Raja, please continue.
I think
I guess
uh,
Some
he is
network
having
problem.
some problem, network problem. I presumably.
okay, okay. Please bring him in as soon as he gets in. And we have another
Achha,
good information. Dr. Rajay is back.
yes.
Yes, sir,
Yes,
you
sir.
are audible.
Yes, audible, sir. Sorry for this disturbance. There is a network issue here.
Right.
Thank you very much, Dr. Saptarshi Halder, and good evening, all of you. So I feel honored to be here today as a moderator to share my views on CME program on the topic of private practice of the BHMS, present scenarios, challenges, challenges and the way forward, and geriatric health in India, concerns and solutions. So I would like to convey my thanks to the organizer for giving me for this opportunity. Without delay, now I would like to request Dr. Srimonti Sanyal to start her presentation. Dr. Srimonti Sanyal, please start your presentation, please.
Thank you, sir. Thank you so much. Good evening, everybody. I am Dr. Srimonti Shanya. I am 23rd batch UG from National Institute of Homeopathy, and I have done my PG in case taking and repertory from Mahesh Bhattacharya Homeopathic Medical College and Hospital. And currently, I am working as a senior research fellow in CCRH headquarters, New Delhi. So today the topic of my presentation is geriatric health in India, concern and solutions. So I am now sharing the slide with you. So this is the slide about geriatric health in India, concerns and solutions. So as we all know, geriatric age group means the age group above 60. So all of us, we are having our grandparents, parents at home who fall in this age group. And as we know that there are two extremes of life, that is childhood and this adulthood or geriatric age group. These two groups need some more attention, affection, and help from the from people around them, because this geriatric age is also called the second childhood of a person, because like a child who is dependent on their family for their everyday works, in this geriatric age group also people becomes dependent on other persons of the family. But this geriatric health is somewhat not much discussed, and it's somewhat neglected in India, because being a third world country, often these age group of people, they are being neglected by their family members, but and they suffer silently from various diseases, but they can't share them with their family members because of monetary issues and any other issues. They don't get proper treatment like that. So as we all know, in homeopathy, there are many patients, they come from this geriatric age group also. So today I will like to share some concern and solution regarding this age group, this geriatric health in India, and the concern and solutions regarding this. In India, India is now in a transition phase. So in India, the geriatric population of geriatric age group is increasing day by day, because due to proper care facility, due to advancement of medical facilities, now there is a low fertility rate as well as low mortality rate in India. So as there is low mortality rate, so the age group above 60, it's increasing day by day. So the India can be called as a aging nation now, because the life expectancy of persons has been increased from last 10 to 20 years. It has been increased a lot. So the unprecedented increase in human longevity in 20th century has resulted in the phenomenon of population aging all over the world, and also in India. According to WHO, World Health Organization, most developed countries have accepted the chronological age of 65 years and above as a definition of elderly or older persons. And according to UN, United Nations, more than 60 years will be referred as the older population or elderly. And in India also, senior citizen means persons being citizen of India who has attained the age of 60 years or above. Now come from the global scenario, coming to the India scenario, some statistics I am going to tell. That is that India has nearly 120 million elderly people with various physical, psychological, economic, spiritual problems with unmet needs in all domains of health. As I was previously saying, that these persons suffer from various diseases and illness, various psychological or physical complaints which are not looked after that much, because people say that they are older age group, they will suffer, it's common like that, and somewhat they are neglected in many places. So the population over the age of 60 years has more than tripled in last 50 years in India. This is because of, maybe because of advancement in medical science, because medical science gives some support, the persons who suffer from diabetes or hypertension, if they are taking regular medication, their longevity or lifespan is increasing. It doesn't say that the quality of life is very much increased, but the lifespan is obviously increased in last 50 years in India. As per the census 2011, the number of elderly people, that is 60 plus years, was 103.83 million and is projected to increase to 132.32 million by 2021, 178.59 million by end of 2031, and 236.01 million by end of 2041, and 300.96 million by the end of 2051. So the current census report has not been published. It was published in 2011, and these are the data which are expected to be get in future. So here again I am saying once classification of old age. The age group of 60 to 69 years are told as young old or not so old. So as we all know, 60 years is a retirement age. Somewhere it is 65 also. Some people, they can work, and at least they are able to do their daily works like that. So this 60 to 69 of years is told as young old or not so old. But the age group of 70 to 79 years are told as old age group, and age group 80 years and over are told as older old or very old age group. So coming to the demography of the geriatric population. So advances in medicine have increased the life expectancy, resulting in an increase in the geriatric population. As I said already, globally, elderly constitute 11% of total population. This has been given by the United Nations Populations Divisions report of 2010 in India. And in India, adults over 60 years constitute 8% of the total population, which is not very less. This the report according to the census 2011. So this is the national survey, 52nd round 1995-96, the prevalence of diseases among elderly people. Here we can see that maximum people, they are having one or other disabilities. Some are having one disability, some are having two, and some are having three disabilities also. These are the graphs which are showing the prevalence of diseases, and this is a graph showing the disabilities. So the National Sample Survey Organization NSSO 42 second round 1986 to 87, 50 second round 1995 to 96, 60th round January to June 2004 have addressed that elderly people, they are having these health and social issues. Those are the burden of morbidity is in old age is enormous. It is very normal that morbidity will increase with the age. And non-communicable diseases, that is lifestyle related diseases and degenerative diseases, are extremely common in older people, irrespective of the other socioeconomic status. These are seen in any socioeconomic group, that lifestyle diseases are there. We can nowadays we can see hypertension, diabetes, these are so common. You can see yeah, rich people, or you can see in a chai wala or rickshaw puller, he is also suffering from these diseases. And in older age group, this non-communicable disease burden is always more than communicable diseases. And the disabilities are very frequent, which affect the functionality in old age, compromising the ability to pursue the daily activities of the persons. So, coming to the factors which affects the health need of elderly people, the major concerns. In the major concerns, I will be telling in these headings, that are destitution, alienation or isolation, social insecurity, financial insecurity, medical problems, and emotional insecurity. So isolation, we all know that nowadays the children or grandchildren, they are going outside for their study purpose or job purpose. Parents and grandparents, they are living alone in cities. We can see they are living alone, and they are doing their everyday works alone, and after sometimes they are thinking that they feel very isolated, because they are not having proper attention from their children or grandchildren. From that isolation point of view, they are develop some sense of social insecurity, that what will happen to me, what I will do if in any day at night I suffer from sudden chest pain, I suffer from sudden health issues, what will I do? These are some insecure feeling they develop. Financial insecurities are also there, because some parents or grandparents, they are spending so much for their children, but when the children, they are going to another place for job or anything, they are not taking care of their parents properly. They will depend on their pensions, or some, those who are not doing jobs, those that daily wage laborers, they suffer from immense financial insecurity in their old age. And medical problems are actually very common issues in old age. With ongoing age, they suffer from medical problems also. And emotional insecurity is always there, because of not getting proper attention, not getting proper help from their offsprings. So these are the major problems the geriatric age group of persons, they feel in their daily life. So we are having the aim of healthy aging. So there are some factors. I think in the slide it's not showing. I have made those. The aim of healthy living. There are some points like lifestyle modification, environmental modification, psychological modification, genetic issues. These are the factors which influence the healthy aging. So, coming to the solutions. Starting with some preventive interventions. In case of preventive interventions, there can be vaccinations can be given, like influenza immunization annually, pneumococcal immunization once at the age of 65 years. And here I haven't mentioned, but also we can think of homeoprophylaxis in case of diseases like in COVID-19 or some recent past. We have used homeoprophylaxis also for older age group, and in for any other particular disease condition, we can use the homeoprophylaxis also. And these influenza vaccine and pneumococcal vaccine immunization, these are also helpful for preventing those respiratory diseases. Coming to the exercise point, exercise, increased physical activity improves physical function, muscle strength, mood, sleep, and metabolic profile of the persons. And regular moderate intensity exercise can reduce the rate of aging associated decline in physical function. as we all know that some kind of physical activity it help to help in a healthy aging. Like aging is invariable, but it will be healthy. They won't suffer from much diseases or disease conditions, or the disease conditions it will develop with much longer time. They will live a healthy life. And 150 minutes per week of moderate aerobic exercises like brisk walking and muscle strengthening exercise, that could also help a person. Now coming to the nutritional status. State of health resulting from the usual food intake, absorption and utilization of food nutrients, and from any pathology influencing this process. So nutritional status, these are determined by factors like age, sex, physical activity, comorbidities, used drugs or stimulants, and socio-economic situation. Obviously, as we all know that nutritional status vary in very every age group. When a person is a childhood, he is developing the muscles. He or she needs more calories, more fatty foods like that. With increasing age, according to the work he is or she is doing, if he or she is doing sedentary work, then the nutrition should be somewhat different. If he is doing any strenuous work, then the nutrition should be different. Like that in old age also, as in old age maximum people are not doing very strenuous work, so the nutritional status will be like that. The foods will be full of fibers, not much fatty foods he or she would taken because of some digestional issues or like that. The foods that would be taken will should be fibrous foods. Plenty of water should be taken. And if the person is suffering from any disease conditions like diabetes or anything like hypertension, like hyperlipidemia, he or she should take his food regarding according to his or her these health issues. And these proper nutrition can help in healthy aging and healthy lifestyle. So these nutritional assessment can be seen like these dietary history can be taken from the persons, the anthropometric measurements like height and weight, the biochemical parameters like serum albumin level, hemoglobin count, HbA1c, all those. And clinical evaluation also can be taken by assessment of the functional, social and mental status, medical history and physical examination of the person. Now coming to the management of nutrition in older people. Management obviously requires a holistic approach, and underlying causes such as chronic illness, depression, medication, and social isolation must be treated. Patients with any physical or cognitive impairment require special care and attention. As I already said, in any diseased condition, he or she may require a perfect diet chart that is required for him or her. Now, as I was telling for a general idea that person should take a lot of drinking water like that. But a person suffering from any kidney disease, she or she has a restriction there. He or she can take only 1 liter of fluid a day. According to the disease condition and everything is suffering from, according to the history of the person's medical history, cognitive impairment, everything should be considered for nutrition this nutritional assessment purpose. Oral supplements or enteral feeding should be considered in patients who are having they are having high risk patients, and they are having unable to meet the daily requirements, so they can need oral supplements or enteral feeding also. Coming to the next point, this is a very important point actually: screening and early management. Actually this has been discussed many times, and some consciousness regarding this screening procedure is always ongoing through doctors and through doctors and in hospitals and everywhere. because screening and early detection and management is very useful to prevent the disease at a early stage. Like for osteoporosis, this is a very common condition in aged persons, where bone mineral density, this is BMD, can be checked at least once after the age of 65 years, once in every 2 to 3 years. Because in Indian population, we see each of our mother, our grandmother, grandfather, they are suffering from knee pain, they are suffering from joint pain, but they take it very lightly at the initial point. They take it very lightly, but afterwards they suffer from severe pain, and there is some structural changes. Then nothing can be done. So and, they are by allopath doctors, they are suggested for knee replacement or like that surgeries, which are very costly and not so available for every person in our Indian scenario. Coming to the next point, that is hypertension. Blood pressure should be checked at least once a year, more often in patients with hypertension, because hypertension is a very common condition now, and not in geriatric age group. If we see from 40 above, patients are suffering in hypertension nowadays. So those who are detected with hypertension, they should be checked in once in 6 months, and those who are already not detected, they should also be more often, they should be checked for hypertension. And because there are some modification of food habits and exercise that should be prescribed in patients with hypertension. In diabetes, in case of diabetes, serum glucose and hemoglobin, HbA1c, glycolated hemoglobin should be checked every 3 years, more often in patients who are obese and diabetic or hypertensive. So hypertension and diabetes, these are so common nowadays, everyone knows. But as I know, in my family also I see, they know that it's they are suffering, but they are very neglect, they neglect in checking, they neglect in the screening procedure. They are taking medicines, or they are not taking, they neglect the screening procedure very much, because they think that if I check, I will be diagnosed with diseases. It's not like that, because in early detection is very uh, useful, and it's very, actually very much needed. Now coming to lipid disorders also, lipid profile can also be done every 5 years, more often in patients who are diabetic or any cardiovascular disease, or having obesity in them, or in family history. They should also go for lipid profile checking also. Coming to this colorectal cancer, stool occult blood test, sigmoidoscopy or colonoscopy can be done regularly up to age of 75 years. Cancer and cervical cancer, these are also very common nowadays. So mammography every 2 years between ages of 50 to 74 years, and cervical cancer pap smear should be done every 3 years up to age of 65 years, and this pap smear should be started after 40 to 45 years. This pap smear procedure should be done in female, because cervical cancer is very much common nowadays. So this should be done. Now coming to the point about psychological problems. For psychological problems, there are some common solution, like the persons should spend time in taking care of their grandchildren, which refreshen their moods. Play with them and try to educate them in studies and Indian culture, how to behave as grandparents, like that. Spend time in offspring prayers, offering prayers, and reading ancient scriptures, which in Indian scenario we see that they do many times. Do some physical exercises and perform yoga and meditation, which will calm their mind and help in psychological problems. And be active in the house and try to helpful to them. Take the children to the nearby park for play, so that will also be a physical exercise for them also, as well as they can communicate with their grandchildren. And generally keep some time of 15 minutes to observe silence. So this is also a very good procedure for calm the mind. write personal diary, what did during the day and what are plans for the future, remain in contact with all family members and close friends and calling them regularly, find the local library and go there for reading books, tackle stress changes in a lifestyle in day-to-day environment and be a normal part of life. So the main solution is to be engaged, to keep himself or herself engaged with some small works, so that they don't feel isolated, they don't feel left out from the society, and these will enhance their mood as well as their physical status also. So now coming to some major government initiatives which has been taken for the elder age group, this older or geriatric age group persons. The objectives are to provide accessible, affordable and high quality, long-term, comprehensive and dedicated care service to an aging population, and creating a new architecture for aging, to build a framework to create an enabling environment for a society for all ages, and to promote the concept of active and healthy aging, convergence with National Rural Health Mission Ayush and other line departments like Ministry of Social Justice and Empowerment. These major government initiatives have been taken. So Ministry of Social Justice and Empowerment, they have a national policy, Ministry of Social Justice and Empowerment national policy on older persons, that is known as NPOP, which was created in the year 1999. This tells to support to ensure financial and food security, healthcare, shelter, and other needs of the older persons. An equitable share in development, protection against abuse and exploitation, and availability of services to improve the quality of their lives. A senior citizen, including a parent who is unable to maintain himself from his own earning or property owned by him, it is an obligation of the children or relative to maintain his needs so that he or she may lead a normal life. So they try to ensure the normal livelihood of a person who has reached the geriatric age group by these aims and motives. Maintenance and Welfare of Parents and Senior Citizen Act 2007. Uh, these have also been observed from the year 2007. If children or relatives neglect or refuse, tribunal may order them to make a monthly allowance which shall not exceed at rupees 10,000 per month. Establishment of old age homes. One must accommodate minimum of 150 senior citizens there, and separate beds for elderly in all government hospitals, separate queue for the elderly in hospitals, and treatment facilities for chronic degenerative diseases and research. Now coming to the Ministry of Health and Family Welfare, they have taken the national program for the healthcare of elderly. It is the most important one, taken in the year 2010-12. The core strategies are PHC and CHC level equipment, training, and additional human resources in CHC and through the IEC materials. In community level, domiciliary visit by trained healthcare workers should be done. In district hospital, 10 bedded wards should be present for this elderly age group with additional human resources, and training with IEC using media, folk media, and other communications. So the for the elderly age group, this was started in the year 2010, which is very much useful. In the Ministry of Ayush, in our ministry, under central government health scheme, that is CGHS, comprehensive homeopathic treatment are provided to the central government employees and pensioners. And centrally sponsored scheme of National Ayush Mission, there is a provision of financial assistance to the states and union territories for setting up to 50 bedded integrated Ayush hospitals and establishment of Ayush facility in PHCs. Under NAM, there is a provision of supply of essential drugs to Ayush hospitals and dispensaries through which elderly persons can avail free services. National Teleconsultation Service of Ministry of Health and Family Welfare started e-Sanjivani OPD, and developed by has been developed by Center for Development of Advanced Computing CDAC, through which Ministry of Ayush is providing online free OPD services to elderly patients, because sometimes they can't come to the OPD. So this e-consultation is very helpful for them also. And Central Council for Research in Homeopathy (CCRH) under Ministry of Ayush is providing health care services to the elderly persons through its 23 research centers and 8 peripheral OPDs located throughout our country. National Institute of Homeopathy Kolkata and Northeastern Institute of Ayurveda and Homeopathy Shillong, National Homeopathic Research Institute in Mental Health Kottayam, all these autonomous institutes which are under Ministry of Ayush are providing the quality health services and also conducting clinical research in respective field. So geriatric health is uh, till now is somewhat neglected, and more research and more health services should be given to them. It should be more concerned, and they should run OPDs for these age group of persons. And Ministry of Ayush and AIMS have decided to initiate work on setting up a department of integrative medicine at AIMS and provide preventive, promotive, curative, palliative, and rehabilitative healthcare in this respective field. The present public health intervention scheme is being implemented since 11th 5 year plan, that is from 2007-8, and still continuing successfully. Scheme is basically developed to demonstrate efficacy of Ayush systems on different public health programs and public health issues through Ayush intervention, so that intervention can be taken up in large scale for implementation in national health programs. Furthermore, given the growing consumer acceptance of Ayush in the domestic and global society, of Government of India had decided to identify reputed institutions engaged in Ayush education and drug development and research and clinical research, etc. For above point to view to implement and merge these two schemes, a wide larger array ministry is proposing one big scheme, uh, and this has been known as Ayush Shastra Yojana. Ayush Shastra Yojana. So these schemes are taken by other ministries, which are Ministry of Railways, which gives separate ticket counters for senior citizens and of age 60 years and above at various PRS centers. Provision of lower berths to male passengers of 60 years and above, and female passengers of 45 years and above, and wheelchairs at stations for old age passengers. Ministry of Civil Aviation in Air India provides concession up to 50% in several cases for male senior citizens of 65 years and above, and female senior citizen of 63 years and above in airfares. Ministry of Finance, they also give facilities for senior citizens of 65 years. There is income tax exemption up to rupees of 2.40 lakhs per year, and deduction of rupees 20,000 under section 80D is allowed to an individual who pays medical insurance premium for his or her parent, or parents, who is a senior citizen. And an individual is eligible for a deduction of the amount spent or rupees 60,000, whichever is less, for medical treatment of a dependent senior citizen, and extra 0.5% interest has been given for the elderly on fixed deposit. Ministry of Rural Development or Annapurna scheme benefits, these are given that 10 kgs of food grains per month is provided free of cost to the person. Implementing Indira Gandhi National Old Age Pension Scheme, pension of amount of 400 rupees, 200 from central and 200 from state government, and the beneficiary is 60 years and belonging to BPL family. This has been launched in the year 2007. This Annapurna scheme for elderly people. And Department of Pensions and Pensioner grievances, a pension portal has been set up to enable senior citizens to get information regarding the status of their application, the amount of pension, documents required, etc. The portal also provides for lodging of grievances. As per recommendation of the Sixth Pay Commission, additional pension to be provided for older pension persons, and age group person pension to be added, like 80 for plus 20, 85 plus 30, 90 plus 40, 95 plus 50, 100 plus 100, like this age group person pension has been added. Strategies and recommendation for primary health services, like geriatric healthcare as a part of primary health services. Care at rural areas should be strengthened. Training of medical officers, peripheral health workers, and volunteers. Screening camps and mobile clinics for reaching out to the elderly population, and involving NGOs, particularly in difficult to reach areas. Community geriatric health workers may be trained to provide home care to the disabled elderly population. Employment of a trained female medical officer to address the increasing health problems of elderly women. Strengthening the elderly in process of self-help by means of physical, psychological, and vocational rehabilitation, and capacity of building of community leaders. And strategies and recommendation of secondary level health facilities, setup of geriatric wards, distinct OPD services providing screening services, as well as curative and rehabilitative services at the tertiary care level, setup of a comprehensive multidisciplinary team provided the specialist services for any disease condition. Geriatric health problems must be addressed, these at all three levels of prevention, and health promotion should also be measured. There should be screening for non-communicable diseases, and rehabilitation should be provided by visual aids like spectacles, crutches like that, mobility aids, and physiotherapy. Rehabilitation should be provided. Focus on vulnerable groups that are below poverty level or other marginalized sections of the society. And economic security should also be given at the national level. A mixture of pension schemes and social security schemes, these can help the elderly population of India. Coming to the role of media, makes the people aware about the problems and services available through the government of India, and through any other NGOs like that, and create a positive perception of the senior citizens in the society. And research in geriatrics and gerontology, common chronic and neurodegenerative disorders, process of aging, pharmacokinetics and pharmacodynamics of drugs, and other research initiatives in modern medicine as well as in alternative medicines should be taken. So now coming to the conclusion, that increased life expectancy, rapid urbanization, and lifestyle changes have led to an emergence of varied problems for the elderly in India, as we have discussed thoroughly. And complete healthcare to the elderly is possible only by strategies for improvement in their quality of life, with comprehensive and multidisciplinary approach. For these, all government medical institutions and private care institutions have to join and work collaborate to create geriatric healthcare facilities. As we all know that many schemes, many things are present. Government maybe trying to help them, but all time it's not reaching to the persons who actually need them. They don't get to know about those schemes. They don't know what to do, where to go, from where they can get the facilities. So by media, by NGOs, by these healthcare providers, we should reach to the persons who are in this geriatric population, because as I have already told, these are the second childhood of the persons, and they need proper care, proper attention, and help from us, because when we were in childhood they helped us. So now this is our responsibility. Those who we are young, we are able to do work, so now we should help them. We should reach to them. We should provide them with proper health care and other facilities. So these are the references from where have taken all the data and everything. As I am a homeopath doctor, I should discuss or tell something regarding homeopathy also. In our pathy, holistic care has always been provided to person, and there are many medicines, many drugs which are very useful for the disease conditions from which the older age persons suffer from. So we should also help persons. We should also take the cases properly, because we have seen many times that older persons, they tell something more what we need. They tell some very much other things from their condition. They like to share with us. They tell many things when we ask with depth. When we ask to them, they like to tell to us, so we should listen to them properly. We should take cases properly, and we should treat them with holistic approach. And some studies have I have gone through. Some studies have been taken care of by in various homeopathic medical colleges. And some medicines like pulsatilla, lycopodium, arsenicum album, these medicines have been coming, though which are very helpful in case of geriatric population. But these are not adequate, I should say, because much more research studies should be taken in various centers, so that we can show the world that homeopathy medicine works on geriatric population, and also with that we can help the geriatric population also. So here I am ending my presentation. Thank you, everyone. Thank you for listening to my presentation. Thank you. Over to Dr. Raja, sir.
Hello. Thank you very much, Dr. Srimonti Sanyal, for giving a very detailed presentation on geriatric health in India, concerns and solutions. She has touched and briefed all the every details in this topic. Uh, so she has started from statistics, how our nation is facing elderly peoples, the uh, increasing the age peoples, increasing the percentage of the age peoples, and she covered very nicely the factors like social, medical, and emotional insecurities and medical problems are playing the major role in the effect of health of the older people. Yes, we also agreed this one. Then she has mentioned regarding the solution, like how we can prevent the intervention by using vaccines, and how the people should do the regular exercise by minimum 150 minutes per week. Then the nutrition status of the older people should take care of by their childrens. So that should be the play the major role, because while the ages are increasing, the immunity will be reducing. So they will get the opportunistic infection and the communicable disease like tuberculosis. In India, if we found that tuberculosis is most common found in older people and child due to the reduced immunity. Then she rightly said that, like the disease, the older age disease like osteoporosis, hypertension, and diabetic and lipid disorders should be screened regularly with frequent interval. And colorectal cancers and breast cancers are very commonly found in our India. So that also should be screened properly and with regular interval. Then another aspect in the older age is the psychological problem. How we can handle the psychological problem of the older people. They are feeling the insecure. So how we can handle it. So she nicely mentioned. Then the major government initiatives by the different ministry and our OIS ministry, and facilities available nearby hospitals, and role of media. She covered all the points. So our ultimate aim in the older age to improve the quality of life, because while ages are increasing, the diseases, the getting the chances of disease are so more. So we have to maintain the quality of the life of the older people, elder geriatric people. That will be our ultimate aim. So in this topic, I would like to add some more. I have gone through the paper, the recent paper. It is mentioned that there are the hypertension, ischemic heart diseases, and cancer is the most of the reason for the mortality for in older age groups. So out of which the one third of the elderly people they are died because of ischemic heart disease in India. So this is the recent paper I have gone through it. So whenever the older people or even the younger people they are nowadays they are getting heart attack. So any doubt we should not hesitate to the refer the patient to the expert, that means the specialist for getting the opinion and for the diagnosis purpose. So we should not hesitate to refer the patient to the modern system because our ultimate aim is to save the life of the person. So we should know the scope and limitations of homeopathy. And the second most death due to respiratory infection. So especially pneumonia. When the viral pneumonia will be there, here our homeopathic medicines are work very nicely. As I worked in the COVID ward in last 2020, so we have seen that our medicines are work very nicely compared to the modern medicines like arsenicum iodide, grandilia, aspidosperma, then Bryonia alba. The patients are recovered very fast compared to the those people are not taken homeopathic medicine, especially when the oxygen saturation went down, even 80, 85. After giving the Grandilia, sometimes Aspidosperma, the patients are within 2 or 3 days, they gain the saturation of oxygen above 90. At the same time, the symptom like cough and fever are reduced fast compared to the allopathic medicine because we have seen and we have reported also. So the respiratory infections we can handle very easily. Even pneumonia also, which is caused by viral pneumonia virus because they don't have any medicine in allopathy. The next, the cause is the 10% of the mortality due to neoplasms, the cancers. So in cancers, as we know, we cannot cure the cancer, but we can improve the life expectancy of the patient and we can improve the quality of the life of the patient. So in our institute, NIH, they are running the cancer OPD in every Tuesday and Thursday, last more than 4 to 5 years. So when the patients are coming without taking an allopathic medicine, maybe they cannot afford the money what they are telling. Maybe due to they want to take supportive treatment. When we are giving the treatment, the patients, the quality of the life is improved very well. At the same time, the life of the patients are improving very well. So the neoplasm, the cancers are very commonly found nowadays in older people, even in young people also. So it should be take care by our system very well by giving either individualized medicine or by giving by indicated medicines. Then, as per ICMR report, the hearing impairment is most common than vision impairment. So this they found in our Indian population. So this is the point I would like to add. Then I would like to add whenever we have to refer the patient, we have to refer the patient in right time to the right person. So that will save the life of the patient also. And we also no need to face any because once the medicines are working, homeopathy, definitely it will work. They will tell the medicines are working. When medicines are they are facing any problem, they will spoil the homeopathic name. Usually, that is a common nature of the mind of the people. So we should be care whenever we have to refer the patient. We should refer the patient first, for getting diagnosis or getting further treatment. Once the patients are stable, we can get back and we can give the treatment. So that will be good for us also and good for our system also. So in the same journal, another one they are referred, more than 70% of the population of geriatric patients, they are unaware about regarding the facilities available in nearby hospital. So our doctor presenter, she told regarding primary, secondary and tertiary healthcare centers, they are having separate bed and facilities for geriatric people, but even though the 70%, more than 70% of the general population, they are not aware about it. So, if it is possible, so we can share this information to the geriatric people. If whenever they need, they can go and have the treatment for oil system and for uh, allopathic system. So once again, I thank you. I would like to convey my thanks to Dr. Srimonti Sanyal for nice presentation. And that's all from my side. Next, I would like to call Dr. D.N. Kalyani sir for presenting his presentation on the topic of tips he had received from his teachers during his studentship. Kalyani sir, please, you can start your presentation. Thank you.
Many thanks to Professor Raja Manoharan, especially for coming with us all along, starting from director, all the faculty members, doctors, clinicians are all along helping us to improve this level of CME. We're really thankful to Raja for nice, not only for nice moderation, but also encouraging us by his presence. You might have observed that most of the time we try to keep moderator from the faculty or the clinician, doctors, or superintendent from National Institute of Homeopathy or director, because our main aim is the teachings, learnings of NI should not be deviated in any way in the CME. We want to be at par all along, present and past NIH. Our teachings must be uniform exactly in the manner form homeopathy wants to improve and NIH wants to teach us. So really many thanks to Raja for coming with us, and we will expect his presence in near future too. Thank you. And many thanks to our brilliant speaker today, Srimonti Sanyal, for giving vividly, very details of geriatrics problems and their aids available from the government and the society. So by his speech, what I learned that many or rather most of the geriatric population people are not aware of so many types of facilities provided by the government and different ministries. So this really, as Dr. Raja told, this CME contribution of Srimonti will help many of the geriatrics. We will try to forward this CME to all the geriatric peoples, by which simply from their home, if they desire for phone, they can get helps. Nice presentation and covering all aspects. Simply, I want to remind you all that it is said that you are very lucky if you born and pass your childhood in Japan, because children are maximum cared in Japan. You are very lucky if you spend your youth in America, because youths of America are maximum cared. And you are very lucky if you spend your older age in India, because India nourished and cares old people's maximum. So those who have crossed 60 or above and Indian are really to some extent lucky that we have been given different types of help from the society, government, and different ministries. Thank you. Now today, because of absence of one of our brilliant speakers due to unfortunate situation, I like to utilize the time by providing some of my experiences, what we have gathered from my teachers. I will not share my experiences in this CME because it will be a very lengthy. Simply, I want to pay my homage, my respect to my senior teachers. Many of them are not at present, they are not available, they are passed away. But how they encouraged us to improve our confidence. I will give you few examples of my teachers. Our teachers used to tell us that knowledge will give you power, but never the confidence. If we apply your power to the cases, and if you see the results of your power means knowledge, then only will gain confidence. And if you go on testing homeopathic medicines on the patients according to homeopathic system of medicine, gradually you will develop confidence. Ultimately, confidence will make you a famous doctor, not only the knowledge. And our teachers, many of them are not very much good, very good orators, very good speakers, but they were beautiful persons to teach students by showing cases. We have learned second prescription, Herring's law of cure, 12 observations, and all philosophical aspects more from IPD by seeing cases than from classes, lectures. That is why I am very happy that I got this chance to share my learnings, my teachings through cases by my teachers. Our teachers more many times used to tell us that I will not be able to, when they ask that, sir, how can we develop this type of qualities of keynote prescription, homeopathic observative prescriptions, then they told us, see, I won't be able to give you my eyes, that you have to develop. Simply see and improve your confidence that yes, it is possible. If you improve your vision, you will see many more things which are not usually been observed or seen by many doctors, and you will achieve the success like magics. So anyway, first of all, I like to tell you a little bit history, not history, facts of two presidents, founder presidents of one is your IMA, Indian Medical Association of Conventional Medicine, Allopathic System of Medicine, and other is HOMI, Homeopathic Medical Association of India. Definitely you have heard, this is recapitulation, you can tell me, that Dr. Mahendralal Sarkar, who was the founder of Cultivation of Science in Jadavpur, a famous research institute on physics, higher physics, in not only in India but also in abroad. So he was basically an allopathic doctor and scientist too. He was the founder president of IMA. In his speech in Delhi, he told that, in his speech, president's speech, that the unscientific system of medicine, like homeopathy, this and that pathy, should be immediately banned by the government because they are doing harm to the society. Anyway, his speeches were stuck to some homeopaths. One of his friends presented organ of medicine by dozen to him in his birthday. Fortunately, Dr. Mahendralal Sarkar studied in details. He told later on, I studied dozens organon 3 times to be confirmed whether it is a science or simply philosophy or art or something else, unscientific thing. The facts happened that next year, when he was called to speak on his presidential speech in annual program of IMA, he told that last year I did a mistake. I told that there are some unscientific system of medicine like homeopathy which should be banned. I am very sorry. There are many systems like homeopathy for which scientific world should strive to find out its details, which is still unknown. Then all the doctors started shouting immediately. You can just imagine if a president says against his speech and encourages other system of medicine, few decades of back, what can be the reaction of the audience? Tremendous shouting. He just shows his hand and says, please be quiet. I know what I have to do now. So he bring out his resignation letter from the pocket and give it to Vice President. I know what I have to do. I am not only resigning from the post, but I am resigning from the allopathic practice of medicine. And from tomorrow onwards, I will start homeopathy practice because I have gone through homeopathy. I have understood what is it. It is a more finer system of medicine. He started homeopathic treatment, and you know that Sri Ramakrishna Paramahansa, in his last phase of cancer, he was only under his treatment, and he was a very famous practitioner in Kolkata. During his last period of ages, he asked his child, to whom he made an homeopathic doctor, and promised him that you promise me that when I will die in my last stage, when I won't be able to react or tell you any medicines, then he will give me, I am suffering from respiratory complaints, he will give me antim-tart 6, no other medicine from allopathy or other system of medicine. If I survive, then I will survive by antim-tart. If I die, my destination, my life has been ended. Nobody can save me. And his son, beloved son, did the same thing. In the last phase of life, last minute, he gave antim-tart, but reaction was very less. Ultimately, Dr. Mandra Sarkar passed away by antim-tart. So this was the history of a founder member of IMA. Another founder member of Homeopathic Medical Association of India, HOMAI, was Dr. J.N. Kanjilal. You might have heard the name. His history was how he was also an allopathic doctor, famous allopathic doctor, used to practice in Delhi and Saroni. How he became converted homeopathy doctors and ultimately became president of HOMAI. The incident was, everybody should know. One day he was practicing in his clinic and suddenly one person started tremendous pain in abdomen, colic pain. The patient was not basically a pain of colic. He was under treatment of Dr. Kanjila for some other disease, but suddenly tossing about and tremendous pain, as if all the patients were startled and doctor had to stop seeing, came before the patient, observed, clinically tested. He was not find any solution, started giving this and that medicine, including injections, but patient did not respond. Time passing out. Suddenly, one information stuck to his mind that there is a medicine in homeopathy which comes suddenly without any reason and becomes very violent. He immediately sent his assistant to the national laboratory in Moulali. There is one big company to bring aconite 6. He brought within few minutes. Patient was given aconite 6, and within few minutes, not more than 5, gradually, patient calmed down and became as before within 15 minutes. Dr. Kanjilal stopped seeing patient for few minutes, became very serious, left all the patients, went home. From the next day, he left his homeopathy practice and he left allopathic practice and started homeopathic practice. In the same chamber with same patient, he simply told, now onwards you will get only homeopathy medicine, no allopathy medicines. He was a voracious reader, very learned person, very aware of modern system of medicine, but ultimately converted. For organization, homeopathy needs organization. Homeopathy needs amalgamation of doctors. He founded Homeopathic Medical Association of India by calling all other stalwarts homeopathy doctors found all over India. I will tell you another history. Was the founder of Calcutta Homeopathy Medical College, which is the oldest college in Asia, Homeopathy Medical College, Dr. B.K. Bose, Vijay Krishna Bose. He was a peculiar type of physician. He had a very big beards like Rabindranath Tagore. While he will sit in the chamber, generally patients are not ordinary patients. All patients are referred or refused cases. He will very quietly take his history in very brief. He will note little but ask details. While taking the case history, after a few minutes he will start eating his beards in this manner. And he will go on telling the complaints. Say, for example, pain in abdomen. He will tell pain in abdomen, pain in abdomen, pain in abdomen. Then thirst, appetite, this, that, pain abdomen, pain abdomen. Then suddenly he will start giving slang words. Bastard, you have come homeopathy before going to the cremated ground, before dying. He will tell any and any language, stop eating beards. Then his followers, students, become confirmed that BK Bose has concluded his prescription. Whatever the case is definitely going to be cured because he has started giving rough languages, which is not expected from a doctor. But if he goes on eating the beards and casually prescribe one thing, it is sure that patient is not confirmed to get recovery. One day, I will tell you one case. The whole thing, what I will tell you regarding BK Bose, I heard in my class from Dr. Mahendra Singh, father of present director Dr. Subhash Singh. He was a brilliant person and very respectful person, did many things for homeopathy. Dr. Mahendra Singh telling that I used to go to Dr. BK Bose's chamber. One day, Dr. Bose has gone to see some other cases by call. One patient party came. I used to know the party. He is telling, Dr. Saab, for 3 months, no improvement. What I'll do, I do not understand. All allopathic hospitals has refused the case. But Sir has taken the case. But no improvement for last 3 months. Tremendous anasarca, very much restricted thirst, complete bedridden, infrequent uremic comatose condition. Patient is almost verge of death. This was the condition. Dr. Singh has seen the case. He went to the case by call with Dr. BK Bose. He was very much well-known case. Dr. Mahendra Singh, what he did, prescription was Apis mellifica 6 for last 3 months. Dr. Mahendra Singh, because Sir was not there, he thought, Dr. Singh told us, Sir, that I thought that 3 months Apis mellifica 6 has got action up to 21 days. So many 21 has passed out. Let us give him 30. He gave one dose 30, then PL, and patient party left with the prescription. Dr. Bose came back by seeing the patient of call. Then it was a system that juniors will tell in details what are the cases came, what was the prescription given. Then Dr. Mahendra Singh told, Sir, that patient came of the nephrotic syndrome, renal failure. He was given 6 for 3 months. I gave him today 30. Dr. BK was suddenly become soft and became mum. Sat down on the chair and asked Dr. Mahendra Singh, you are coming tomorrow? Dr. Singh told, yes. Yes, sir, I will come tomorrow. Okay. And he saw rest of the cases. Dr. Singh came back. Next day morning, as usual, Dr. Mahendra Singh went to BK Bose's chamber, was seeing cases. Dr. Bose was also seeing cases. After some time, a person with white dress and wearing that key came and asked doctor, Sir, one death certificate is needed. My father has expired yesterday night. Dr. BK Bose just saw the patient party and asked Mahendra Singh, give the certificate, death certificate, and ask the party, you take the certificate from him. Dr. Mahendra Singh was surprised. For 3 months, patient was as before, no change. By simply 30, patient died at night. Then he simply heard the situation. What happens? The last phase. Patient party told that after medicine was given, Then gradually, my father, for few hours, as if the patient is improving. Then gradually, patient become sleepy, drowsy, then stop talking, completely unconscious, and ultimately died at night. Chamber was closed. Dr. Mohinder Singh could not left the chamber. He prayed excuse from Dr. Bikabo. Sir, it was my blunder. I did not realize the organ of medicine. Then Dr. Bikabo told him, organ of medicine is a very small book, but sometimes it needs a whole life to realize. That stuck to Mohinder Singh's mind, and he became confident that I will work throughout my life on organ only, because there are many things yet to be known, yet to be realized. The single increase of potency for a fatal case, a case of verge of death, can immediately kill the patient, as we have studied from the 12 observation. And we know that Dr. Mohinder Singh was a famous person in organ and wrote many books. This was experience of Dr. Mohinder Singh we heard in our classroom. I am sharing with you, because we must be very careful to prescribe a patient, especially to a very fatal, serious, tremendous pathological change cases. At that time, LM potency was not that much available, rather not available at all. I want to add few more experiences of Dr. B.K. Bose, just to pay respect to him. There was a dumping garden of Calcutta Corporation, where you are seeing now Calcutta Homeopathy Medical College. He was direct disciple of Dr. J.T. Kent. During freedom fight, he had to left, because he joined in freedom fighting. He left India and hid, fortunately, in a space just before his residence. One doctor was treating homeopathy. Many of the patients are getting cured by simple globules. He was astonished. Ultimately, he went to him, the doctor, and requested him that I am coming from India. I want to learn your system. That doctor was Dr. J.T. Kent, and the student was Dr. B.K. Bose. After getting confidence on homeopathy, he came back to India, started treating homeopathically. Then he asked the government to give a space for homeopathic hospital. Government at that time did not have any intention to help homeopathy in any way. Then Dr. Bose was told there is no space in Calcutta. Calcutta is not a cheap place for anything and everything. Then he told the then minister, sir, there is a dumping garden. A little space is left. Can I use it if you give me permission? Okay, you go. You do whatever you like. So that simply verbal permission, ultimately he took it in writing and started seeing patient in a deep shaded, corrugated tin shaded shed, seeing the patient just side of the garbages. Gradually from that shed, he used to see the referred cases or serious cases, and the condition was he will first ask the patient how much you have spent for your treatment, and patient have to tell the exact amount. Then he will tell the patient that much amount you have spent, but your condition has deteriorated. 10% I want. If you are ready to give it, then you will be cured. Then patient party is telling, yes, I'll give you. No, not to me. The workman, we call this Raj Mistri, the builders, they are working there. You bring bricks for that amount, give them. We will make one hospital. By this way, by curing one patient and collecting donation from the one patient, Calcutta Homeopathic College was built. If you go there, in the first floor, second floor, you will see number of plates are there, from whom Dr. B.K. Bose took donation by curing them, including mother of Chief Justice. You will see that, probably I told you before, in Calcutta Homeopathy College, the main building, first floor, on the road, you will see it is written LV Mitro maternity ward. By curing or by making one normal delivery to mother of Chief Justice Shankar Prasad Mitro, LV Mitro, he was offered anything and everything because he has not only saved a life, a boy, child, a newborn, but also saved a whole family. So that he requested, I don't want thing, I don't want a single farthing. I want a maternity ward where many mothers will have safe delivery pregnancy by homeopathy. Immediately he agreed and made that portion. If you go there, you will see LV Mitra maternity ward. So this was the history of development of homeopathy in the very, very beginning. And this type of persons were there who were homeopathic in true sense. Next, I like to pay my homage to another of my teachers, Dr. P.C. Pal, a very famous person. He was disabled by polio myelitis, but a tremendous type of person. He used to tell us in the first year and second year that you are not liking organ. We told them, sir, organ is a very bad subject, not having any taste like physiology, anatomy. Then he told, okay, you just chew it like haze, like cows. Keep it inside in your throat. You will swallow when you will study philosophy of homeopathy. That I will teach you in third year. At that time, DMS was for 4th year only. So he used to teach philosophy only from third year and fourth year. As I told you, his teaching was not very much brilliant, but what he will teach little, he will show it in the IPD, one after another philosophical pictures, by which he got the confidence. I will tell you few cases of him. Once, a boy, student of second year, there was a student Kevin in Calcutta Homeopathy Medical College ground floor. One boy was admitted, second year student, for a serious complaint. Complaint is the student was suffering for 2 months from very high rise of temperature, burning urination, ultimately temperature remaining as before, became emaciated, cachectic like anything. When he was admitted, he is passing only blood and pus, little quantity of urine with tremendous strangury, burning, pain, and blood. When he was admitted, at that time, Dr. S.K. Dubey was very famous to the students because he used to teach anatomy. He was gold medalist in anatomy, Dr. S.K. Dubey. But he was to teach Mathematica too. So because he's a famous teacher and beloved by the students, that student got admission through RMO under Dr. S.K. Dubey. After getting admission, immediately, as because the condition was very serious, there was one surgeon at that moment available, Dr. S. Moitro. We had 2 surgeons in Calcutta Medical College. Dr. S. Moitro was called MS to see the cases, to suggest what to do. He came, saw the student, and immediately changed the patient to any well-equipped hospital. He needs renal transplantation because he is passing pus and blood for few weeks, means either both the kidney has been damaged or any of the kidney has been damaged. So patient is going to die within a very short period. Surgeon told, advised, put it in the note of the IPD card, left the room. Suddenly, Dr. P.C. Pal was going to the IPD department to see the cases. And he saw that one student has been admitted in student Kevin. He simply put his head in and asked, "Ki hoyeche? Ekhane keno?" I think you are following the language. What has happened? Why you are here? Then the student started crying that this is my complaint. And surgeon came and he has told me to renal transplantation. I have to be shifted to some other hospital. But I want to be cured by homeopathy. Otherwise, I am not going to study homeopathy. I don't have that much faith if I don't get it. If I don't cure. Then he asked, okay, ঠিক আছে, দেখছি. Then he heard all the complaints from the student. And the last question, only question he asked, did you had severing after or during urination before starting of this suffering? The student simply nodded. He said, yes, sir. At that time, RMO and other few doctors has come there because PC Pal is seeing the cases, and case is very serious. Student case, there may be turmoil among the students. Immediately something have to be done. By doing something, he will be transferred to some other hospital. Then PC Pal ask RMO, come make a board on his bed. Nobody should touch the patient. Nobody should give even PL. Give him sarsaparilla 6 one dose. If anything happens, you just call me over phone. He left the room along with all the doctors. RMO was surprised. I also became mummed what to do because he was the most senior doctor, vice president of the college, and was respected by everybody. Everybody was stunned what to do in this stage. Sarsaparilla 6 only, one dose. He was very much serious type of person, Dr. P.C. Pal. Then the same surgeon came back, Dr. Dubey came, Dr. Isar Chatterjee came. Many of the teachers came in the student cabin, saw me, saw the student, and ultimately they told, let us see at least one day because sir has given the medicine prescription and he's not an ordinary person. What happens? One RMO, one house staff was kept on my cabin to observe every moment. After evening, gradually, student became unconscious, comatose. Student heard that immediately Dr. P.C. Pal was rang over phone, said patient has become unconscious, comatose, what to be done? Many of the teachers are here to what to be done immediately. Should he shift the patient to some other hospital? Then the reply from him, Dr. P.C. Pal, was, I will give him death certificate tomorrow morning. Nobody should touch him. I am telling you. Nobody was dared to do anything. I was kept as it is, unconscious, comatose. 24 hours vigilance by many of the teachers. Even at midnight, teachers came to see the student. After midnight, gradually the student felt that some serious, hideous things are before moving in his eyes, peculiar type of sensation in the body. Then again he became unconscious. Early morning, while he is getting up from the bed, presenting a house staff, he was whole night he was awakened. RMO was awakened. Early morning, a little bit better. Dr. P.C. Pal came at 9 and saw the student, asked him, how do you feel? Student said, sir, a little bit better. Did you have urination? Yes. How do you feel? Little bit less. Temperature as before. He immediately left, right in the IBD cases. Regular culture with count, bacteria count. Regular urea creatinine. And keep the records. Gradually, the student becomes better. All along, he was under placebo. After 3-4 days, temperature subsided. Pus become absent. Pus cell also in urine became absent. Blood cell was absent. On 5th day, culture reports came negative. The day report came, Dr. Pisipal came to see the student. Dr. S.K. Dubey, Dr. T.P. Mondal, Dr. Mahendra Singh, many of the teachers, they were standing before the student. Principal came in, asked the surgeon in this language, ki he, homeopathy te bacteria more? The surgeon reply was, ha sir, যা দেখলাম জীবনে ভুলবো না. Means principal asked the surgeon, can bacteria be killed by homeopathic medicine? Surgeon replied, yes, what I have seen. By a single dose of medicine, such type of infective disease can be cured. I will never forget in my life. So this was the effect of Sarsaparilla in a severe case. When the student, he was released from on this 7th day from the hospital. After another 7 days, he was asked to report. When on 15th day, when the student came back and asked that by this time he has gone through the literatures, asked Dr. Pisipal, sir, there is a chance of hypertension, essential hypertension due to renin-angiotensin, kidney damage. Can you think of it? Then Dr. Pisipal told, if you have blood pressure ever in your life, you tell me, I will stop homeopathy practice. Such type of confidence of the medicine by single symptom, such type of confidence and potency, such type of confidence in homeopathic 12 observation, such type of confidence in pathology, such type of confidence in prognosis. And till now, at this moment, that student is 67 years of old, never had blood pressure. You'll be happy to know the student. That student is your known person, Dr. D. Kalyani. So anyway, after getting the cure, complete, what should I say? He had no faith on homeopathy. After seeing that recovery, cure, he became so much confident that all along his life is trying to encourage other students and doctors. Another case of Dr. Pisipal I want to tell you. Because I become very confident regarding homeopathy and Pisipal, my grandmother became seriously sick. He was attacked by hypertensive encephalopathy. First, she was admitted to National Homeopathy Medical College. There he was for about 1 month, no change, completely coma with catheter and Ryle's tube and saline drip, food drips. Then he was taken to National Neelratan Sarkar Medical College in Ehtesham, Shialda. There he was another 3 weeks without any change. Ultimately, NRS told there will be no change. Patient is going to die, but you have to wait until her last breath. There is no treatment, any more treatment. She have to continue Ryle's tube, catheter, and drip. Not even a single drop of water is being swallowed. Then my relatives told me, can homeopathy do something? I directly went to Dr. Pisipal and told the case. He immediately started shouting, no. This is not the place to bring the patients and kill and arm defames. We are not going to take anything. Don't bring her here. I was immediately refused. Then I went to Dr. S.K. Dubey, Dr. Mahendra Singh, Dr. M.M. Datta. I request everybody, sir, there is no hope. They have left the case. Can anything be done? Then my teachers went to Dr. Pisipal. He was in his vice principal's room. 3-4 teachers at a time requested, sir, everybody knows she will die. But we have seen your magic eyes. Can student learn something? Then principal nodded. He said, okay, admit. She was admitted. Dr. M.M. Dotto, many of you might have seen him. He used to come in a night. Regular, he used to follow principal all along. So long he will go to the IPD and visit the patients, he will be, Dr. M.M. Dotto always will be with him, and he will write in the prescription pad as per direction of the Dr. Principal. Once we asked Dr. M.M. Dotto, sir, how principal is first type of prescription comes in his mind, how he is doing? Can you teach us the process? Then Dr. M.M. Dotto told me, see, my hairs has become grey, skin has wrinkled. Still, I move with him every day. You just imagine, just try to understand his depth of knowledge, his vision, his eyes. Anyway, my grandmother was admitted in Calcutta Homeopathy Medical College. First day he went, saw the patient, heard the history, prescription was placebo. Second day, placebo. Subsequent 6 days, patient was under placebo. On the 7th day, suddenly he told Murari, M.M. Dotto, first name was Murari Mohan Dotto. Murari, give him brownie at 12 one dose. We all were there, many of us were there. We were surprised, such a type of serious case, brownie acute drug, that also 12 potency, uncommon potency. And he never used to repeat anything. He just told and went out. Dr. M.M. Dotto wrote it, left the patient. Next day morning, when he went to the college, there was a shouting among the students in class that your grandmother has improved a lot, tremendous magical improvement. Yesterday night, he has taken glass of water, tried to drink, glass was falling down, it was broken. He is looking, trying to speak. Immediately ran to the IPD. There I found that RMOs, house staffs are there, encircling the patient. After some time, principal came. M.M. Dotto was also with him. He came, saw the patient, and immediately told, release the patient immediately, told itself. And he left immediately. He heard everything. That other co-patients, sisters, they told, at midnight, suddenly patient started moving his hands and legs. He tried to take the glass of water from the cupboard. Cupboard was very low, and the glass was fallen down in the ground, that was broken, could not drink. Since then, he's looking and searching something and moving his hands, legs. We were very astonished and very surprised by seeing the improvement. But the teacher, prescriber, he is telling me, immediately discharge the patient, today itself. Again, I went to my teachers, Dr. Dubey, Manu Singh, and all other beloved, respected teachers who used to love me very much. Sir, what is this? First step improvement, sir, is not, sir is tend to discharge. M.M. Dotto became mum. He told me, let me try. All the teachers went to him, Dr. Principal requested, but he was unmoved. No, you requested me to show homeopathic efficacy that you have observed. Now the patient is going to die. There is no one in the universe, no system can save him. Only to show the 12 observation, I agreed to admit the patient. Homeopathy medicine, first time reduction of a serious disease, is a definite sign of definite death. No one was able to agree, Dr. Principal. No other medicine was given. We had to take back the patient even after waiting for 3-4 days. Gradually, patient again started sinking. We took the patient home. After a few days, she passed away. Then we asked Dr. M.M. Dotto. We did not dare to ask Dr. Principal why the prescription was. Dr. M. Dotto, every day we are asking, sir, why Brian at 12? And M. Dotto is saying, you try to search, try to find out. Definitely he has seen something. Then after discharge, M. Dotto told me, I asked sir, sir told, you have not observed that his one hand was automatically having little jerk. By 6 days observation, Dr. Pisipal observed the slightest jerk of one limb, upper limb, that you know which limb. That was the line of prescription. And just imagine the potency which can give ammunition within few hours, not even 24 hours. This is another experience of 12 observation and homeopathic prescription. Sorry, I have number of cases. Anyway, let me tell you few more things. One is I will be little bit hasty. Then few months after, I admitted another of my auntie, distant auntie, with anasarca for severe diarrhea, persistent liontaria for months together, leading to anasarca. Patient was admitted in IPD. Dr. M. Dotto was accompanying Dr. Pisipal. Under Pisipal, we were with him. He saw that from a far away, from far distance. Just he entered the door, and M. Dotto told, sir, this is the case. He saw the case. By this time, he heard it. That patient is having tremendous diarrhea and anasarca. From distance, he told, have you given Syncona 6? Then M. Dotto by this time became very much expert. Yes, sir, I have given Syncona 6. Bas, take it. He left IPD. And you'll be surprised to know that liontaria, that tremendous diarrhea, gradually improved. Anasarca improved. Within 10 days, patient went home and he passed his normal life till his death without any other disease, simply by Syncona 6, only one dose, which will be unbelievable. Many of my students in NIH used to tell in their hostel that Dr. Kalyani is expert in giving bluffs on homeopathic cure. Because I used to encourage my students by telling the cases. I think they are realizing while they are practicing that what homeopathy is truly. Another case of Dr. P.C. Pal, one case of cirrhosis of liver was admitted under him. Syncona 6 was given. After, I'm making brief, after 16, 17 days, patient suddenly telling, sir, can I go home for a day because I have some problem with pension, I have to take it. They started shouting. Is it now? Now it is necessary. Can you not wait for a few days? Or could you not do it before? Anyway, other doctors requested Dr. Pishipal. He allowed the patient to go back to home. Chelidonium 6 was given to the patient. Patient came back by performing your pension problems. At night, gradually patient becomes sick. Gradually sick. Then immediately Dr. Pishipal was informed over phone. He simply told, I became angry because I was very sure that he is going to die. Because cirrhosis of patient by so many low patency is improving and becoming gradually fresh, and he is desiring to remove the troubles, the difficulties of pension. Is a very, very bad sign, very fatal sign for the patient. Then by force, patient was kept for a few more days in IPD hospital in Calcutta Medical College. Ultimately, chelidonium was repeated. Other drugs were repeated by other doctors, but ultimately patient passed away within 2 days. Another case of chamomilla of Dr. Pishipal. At midnight, he was called over phone. He came. He was taken to the hospital. As I was telling, LB Mitra maternity ward. There was a completed labor. He just hinged his head inside the labor theater. We were all sweating. Two gynecologists, Dr. M. Ghosh, Dr. M. Ghosh, many of you might have seen in NIH. Dr. M. Ghosh Dr. S.C. Chatterjee was there, gynecologist, Dr. K.K. Rai, three gynecologists were there. Patient was going to die of obstructive labor. Dr. P.C. Pal just put his head inside the labor theatre and tell me, have you given chamomilla? No, sir. Give him chamomilla 6. By saying these words, he left hospital. Gradually, patient had normal delivery, fetus, newborn, and the mother become normal. Next day morning when he came, teachers and students all together told Dr. Pishwal, sir, what was the guideline? By seeing the patient from distance, you gave chamomile and patient became normal before two gynecologists, which was so much obstructed labor. Dr. Pishipal so told, you have not observed that he is giving slang language to his husband for her pregnancy? Is it not enough in this stage, fatal stage when patient is going to die? Doctors are become nervous for his seriousness. Mother is giving slang language for having this pregnancy for the husband. Is it not enough for his anger? So anyway, and you will be surprised to know that patient was one of the relative of Dr. T.P. Mondal. Her cousin was one alumni. I cannot remember exactly her name. Her relative was this patient. I think it is already. Bidyut, can I continue for a few minutes more? Anyway, let me tell you a few more cases. Dr. M.M. Dato, many of you might have seen. বল একটু করা যাবে না আজকে ছাড়বো এটুকুনি বিদ্যুৎ
Yes, sir. It's very interesting.
So
আর
should we
5 মিনিটের
continue
মধ্যে
few?
শেষ করি। হ্যাঁ স্যার, হ্যাঁ স্যার।
Let me tell you a case of your known teacher, Dr. Murari Mohan Datta, M.M. Datta. He used to teach mathematica in OPD in a manner that the cured cases, improved cases will be taken after 3 p.m. The interested student will come there. Everyone will take cases separately. Dr. M.M. Datta will sit quiet before him. Then he will ask every student, what is your drug for the patient? Patient is sitting before Dr. Datta. All of us will be asked, what is your drug? What is the reason? Justify. Then we'll go on telling the drugs. One day, one patient of polyarthritis with deformity, serious complaint of one very famous school mistress, with well-dressed. He was sitting before Dr. M.M. Datta. He got tremendous improvement, but prescription was surprising to us. Prescription was high CMS. Then we all took separate case history. Somebody is telling Netemmu, somebody causticum, this and that. We are all trying to justify our prescription, but Dr. M.M. Datta telling 1, 2, 3, 1, 2 symptoms and null and void. Means uncommon, peculiar or mental uncommon symptoms are very much essential for conclusive prescription. Ultimately, all we failed. Then Dr. M.M. Datta asked the patient, see the OPD card. In OPD card, it was written high CMS 200. Ask the patient how she is. Patient said, "Haan sir, আমি আগের থেকে অনেক ভালো আছি. I treated in many places, but got no improvement. By your medicine, I am improving a lot. I am not a person to come for a free treatment in Calcutta Homeopathy Clinic. I have plenty of sources. I am a teacher of a renowned school. I can very easily pay. But by hearing from somebody that there are very big teachers in this hospital, I came to you and fortunately came to Dr. M.M. Datta. Then M.M. Datta told, okay, madam, he used to tell ma, ma apni jaan, hoye gache. Patient left the cubic, means that place we all together we are sitting. Then M.M. Datta told, what is the prescription? Why? None of us were able to reply. Then Dr. M.M. Datta told, have you not observed that a school teacher has come to a hospital, free hospital, with such a well-dressed, having wool in his hand? He is knitting wools while we are talking, well-dressed, and while he is laughing, her laugh does not represent teacher's laugh. It is laugh of the actress. at that যাত্রা was very famous. বললেন যে যাত্রার আর্টিস্টরা যেরকম হাসে সকলের সামনে, ঠিক সেরকম the laugh as if evil is visible from outside. Such type of laugh by opening whole mouth is not a common picture of a school mistress. So basically he is lascivious. Because he is a teacher, he is subsiding. It is not easy to assess. It came to my mind. I observed it. All the time he is coming in the OPD with a dress unparalleled to any of other patients. Automatically he will draw attraction of others. This is the indication, mental indication, why I prescribe Homeeopathy. Okay, if I get time, then I will discuss few more cases of my teachers, then my cases. So what I want to tell you, that my teachers is to tell us that develop confidence, not by keynote prescription, means observation. There are many indications which patient will not be able to tell you. We have to observe. So see the patient. Starting from our teacher is to tell that to learn Mathematica, travel, have train journey, have bus journey, see the movies, see the characters. In the name of your Mathematica drugs, who is Netamune, who is Pulsatilla, who is acid nitric, who is ferrometallicum, who is graphite. If you go on seeing pictures, means movies, theaters, other actors, acts, have a journey. You are sitting in the train. There are plenty of passengers. Try to find out who are the passengers, who is Netamune, who is Ignatia, who is Calcutta, who is Calcutta Force. If you develop the practice of assessing persons by Mathematica drugs, you will learn more Mathematica than by reading your books. So observation by your family members, natives, friends, co-passengers, movies, if we develop the habit of seeing by Mathematica drugs, not by names, we'll learn many things and we'll develop this type of visions to find out the uncommon mental symptoms to have very fine and perfect prescription. Thank you very much. Thank you for coming, joining those who are present, observing this CME, those who will see this CME later on. Everybody, our heartiest thanks. Our request, very one earnest request to come forward to improve this CMEs, by which all of us will be encouraged, confident, and improve our system. Thank you very much. Raja, please.
Thank you very much, sir. I would like to convey my thanks for giving the tips what you have received from your teachers during your studentship. So we surprisingly see that our medicines work very magically in certain cases, especially in Chamomilla 6C making the normal delivery. Then how Chincona 6C you worked in Anasarka. Then Sarasabarela 6C worked in renal problems, and Aconite 6C for abdominal pain. Thank you very much, sir. Thank you very much for your sharing your teachers' tips. So in future CME, from my request, you can share your tips also, because you are an experienced person. As I have joined, I have seen that you are dedicatedly seen your patients with good success stories. Thank you very much once again for organizing committee. So here I no need to, I don't want to add anything because you have shared your teacher's experience. So my age and experience are very less compared to your experience. Thank you very much, sir. So I would like to hand over to Dr. Saptarshi Halder to take over the session, please. Thank you very much.
Okay, thank you, Dr. Kalyani, and for his valuable speech. And it was really great to listen from him. such a eminent physician in true sense. And also, thank you, the moderator, M. Raja, for wonderfully moderating the whole session. And mm, now I would like to hand over the session to Dr. Bidyut Mukherjee for conclusion.
Thank you, all our speakers, inaugurator, moderator, sirs, for your presence, for giving us your valuable time, and to enrich us with a lot of knowledge. And we are really proud to have Kalyani sir, Sarkar sir, Eshwarada sir, and so many stalwarts who are our proud alumnus from NIH. Now, every day is a learning phase, and we are learning day in, day out. Today's topic was different, private practice by Dr. Ehtesham Khan. But the way Kalyani sir had taught us, and through his light, we were being picturizing Calcutta Homeopathic Medical College in his student days. The way he himself, as a student and as a patient, how he gained the knowledge. The similar things we learned during our tenure in NIH in the OT with Dr. M. Ghosh, and along by the side of Dr. Kalyani, Dr. P.K. Mishra, Dr. Uh, Sunimal Sarkar sir, Dr. M. Datta. So these things we are still have vivid memories from NIH, and we are expecting and from the present faculty that the same legacy to continue. The surgeon, the gynecologist, the practice of medicine specialist, by working hand to hand uh, with our homeopaths to enrich us with vivid knowledge of our homeopathic medicine action by the bedside. Now, we have also the confidence of homeopathy being shown by the medical superintendent, Dr. Pralay Sharma. His mother is in hospital of NIH, and he is looking after his own mother with the medical board of NIH. So this is the confidence we homeopaths should show uh, on our own families, like we heard from Dr. Kalyani on his own self, on his grandma. So similarly, we are now having Pralay's mother in our NIH cabin, NIH hospital, and let us pray for her speedy recovery. We have very encouraging announcement that uh, our alumni meet will be on 9th of December at Kolkata. And after, in mid-September, we'll be meeting our NIH authorities to discuss with the eternity and the number of delegates. Our request to all the alumni across the globe who are willing to participate in the meet, please avail the early bird offer, which ends on 31st of August, for enrolling yourself in the Alumni Meet 2022. And our best wishes from Alumni Association to all those guests, alumni who had been today at Delhi to have a get together to discuss their yesteryears and make a plan to come at NIH on 9th of December. We all are eagerly waiting for the date 9th of December to come together. Let's all meet after the two grueling years of pandemic, and let's all sit with our teachers, our students in NIH, and spend a very warm day at NIH during the winter 9th of December. So with this note and with permission of Kalyani sir, sir, I am returning back to our backstage editor, Orko Mukherjee.
Thank you very much.
Thank you. Many thanks to all of you.
Thank you, sir.
Thank you all. Thanks for watching. I Hope you have enjoyed today's CME and gained few knowledge about today's topic. And also, thanks for waiting for this long from the start. As I have said earlier, that it is being said that the main ideas were of that I have that we, the IT team, have done a work on presenting the highlights of future means past CMEs on Spotify, and the link for that is given on the description below. You can go and follow that playlist, and after following that, you will get updates on every week. We will try to upload on every Sundays if possible, but if not, every Fridays. So stay tuned with that. And this was the main thing. And one more thing to just say, just to add on this, that we are facing. I have got some news about the issues with certification of participation certificates. So let me tell you that this participation certificate will remain closed for like September end, because due to some server errors, and it will be resuming from October, means all the CMEs from October, which will be held on October. All the CMEs which will be held on October will totally be having a participant certificate. Like majority of our IT team members are having exam, and we will be giving our organ on exam tomorrow. So that is the main reason we are facing these issues, and this is the second main reason we are facing these issues. So I hope you give us some wishes for tomorrow's exam and other upcoming exams. And with this, thank you to the teachers, thank you to Kalyani sir, thank you to Baba and other speakers, and also the moderators, and also inaugurator sir for having me and also crediting me. With this, I am now taking, I am now leaving, and everyone have a good night. We will now move on to post CME talks. Until then, it's me, Orko Mukherjee, your IT manager. Bye.